Welcome to topic dengue and low platelet count. By the end of this topic, you should be able to describe dengue and severe dengue, understand the global burden of dengue, describe the pathophysiology of low platelet count in dengue.
Let's take a look at this case. A 60-year-old woman, housewife, admitted in hospital with complaints of high-grade fever with chills, headache and malaise for 3 days. On examination, blood pressure is 100 by 70 mm of mercury, heart rate 94 beats per minute, respiratory rate 28 per minute, temperature is 38.8 degrees Celsius. On investigations, hemoglobin is 13.6 grams per deciliter. Total leukocyte count is 3,400 per cubic millimeter. Platelets, 70,000 per cubic millimeter. Malarial parasite is negative. Dengue IgM and IgG are positive. What is your diagnosis? Why platelet count is low in this patient? Let's discuss this case in the forum. What is dengue and severe dengue?
Doctor, what is dengue fever? Is this serious?
Dengue is a mosquito-borne viral disease that has rapidly spread in all regions of WHO in recent years. Dengue virus is transmitted by female mosquitoes, mainly of the species Aedes aegypti and, to a lesser extent, Aedes albopictus. Dengue causes a wide spectrum of disease. This can range from subclinical disease, people may not know they are even infected, to severe flu-like symptoms in those infected. Although less common, some people develop severe dengue, which can be any number of complications associated with severe bleeding, organ impairment and/or plasma leakage. Severe dengue has a higher risk of death when not managed appropriately. Dengue should be suspected when a high fever, 40 degrees Celsius, is accompanied by 2 of the following symptoms during the febrile phase. Severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen glands, rash. A patient enters what is called the critical phase normally about 3 to 7 days after illness onset. It is at this time, when the fever is dropping below 38 degrees Celsius, in the patient, that warning signs associated with severe dengue can manifest. Severe dengue is a potentially fatal complication, due to plasma leaking, fluid accumulation, respiratory distress, severe bleeding, or organ impairment. Warning signs that doctors should look for include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigue, restlessness, blood in vomit. Dengue is caused by a virus of the Flaviviridae family, and there are 4 distinct, but closely related, serotypes of the virus that cause dengue: DENV1, DENV2, DENV3 and DENV4. Recovery from infection is believed to provide lifelong immunity against that serotype. However, cross-immunity to the other serotypes after recovery is only partial, and temporary. Subsequent infections, secondary infection, by other serotypes increase the risk of developing severe dengue. Let's see this infographic to see the impact of dengue worldwide.
Doctor, what is the pathophysiology of low platelet count in dengue?
Doctor, why platelet count is low in dengue?
Increased destruction of platelets causes thrombocytopenia in dengue. Thrombocytopenia may also be due to 1. Platelet consumption during ongoing coagulopathy process, 2. Activation of platelets, or 3. Increased peripheral sequestration. Thrombocytopenia has always been one of the criteria used by WHO guidelines as a potential indicator of clinical severity in dengue.
Let's test your understanding on the topic. Click on the correct answer. Which of the following is the characteristic finding in severe dengue? Bleeding gums, muscle and joint pains, nausea, severe headache. The right answer is bleeding gums.